CSF circulation. So what's the normal CSF volume? It's 100 to 200 ml and the production rate is 20 ml per hour. So 20 ml CSF is produced every hour and the total volume is about 100 to 200 ml. So how does it passes from the ventricles, or how does it passes out of the ventricles? The CSF exits from the fourth ventricle through the two foramina of Luschka and foramen of Magendie. Fourth ventricle has three foramen in it: cerebral of aqueduct, which connects it to the third ventricle. So the fluid formed from the lateral ventricle comes into the third ventricle through foramen of Monro, and then from third ventricle through cerebral of aqueduct into the fourth ventricle, and then it goes into the subarachnoid space through foramen of Luschka laterally, they are two in number, and foramen of Magendie, which is one, into the subarachnoid space. Then the fluid circulates in the subarachnoid space and absorbs into the venous circulation through arachnoid granulation into the superior sagittal sinus. So it's produced by the ependymal cells and the blood vessel around the ventricle and is absorbed by the arachnoid granulation into the venous circulation into the superior sagittal sinus. CSF pressure is on the average 7 to 15 millimeters of mercury, and more than 20 is increased intracranial pressure. If the CSF pressure falls, its absorption is decreased. Now, what are the results of decreased CSF absorption? Decreased CSF absorption through the arachnoid granulation as occur in subarachnoid hemorrhage and other hemorrhages. Fluid accumulates in the subarachnoid space and increase in the CSF pressure known as external or communicating hydrocephalus that leads to increased intracranial pressure. So if there is decreased absorption through arachnoid granulation, that increases the CSF pressure, that leads to increased intracranial pressure. Also, CSF blockade through the foramen of Luschka and Magendie leads to accumulation of the CSF proximal to the block. Here it's Luschka and Magendie. If they are blocked, then it causes increased pressure proximal to the block. That increases CSF volume and increases the intracranial pressure in the ventricles. Connections of the different foramen. Foramen of Monro connects the lateral ventricles. These are the lateral ventricle, and this is the foramen of Monro that connects it to the third ventricle, and from the third ventricle through the cerebral aqueduct it's connected to the fourth ventricle, and the fourth ventricle is connected through the foramen of Luschka and foramen of Magendie to the spinal cord. So foramen of Luschka is on the lateral side of the fourth ventricle at the CPA, cerebropontine angle, and connects it to the subarachnoid space. Foramen of Magendie is the median foramen and opens in the midline and CSF from fourth ventricle into the subarachnoid space. So CSF exits through the foramen of Luschka laterally and from foramen of Magendie medially into the subarachnoid space. So there are four openings in the fourth ventricle: two lateral foramina of Luschka and one median foramen of Magendie, and one cerebral of aqueduct connects the fourth ventricle to the third ventricle.